Today I want to show you a really cool new feature which is available on the iTero. And do you remember when you are going to do a prep scan and then you write a prescription to your technician? Sometimes you want to actually explain something which can be a bit tricky to do in text. And we now have the ability to add video and photos to our prescription. The one thing you have to remember is that you can still only make the prescription from the iTero. You'll have to upload video and pictures on MyiTero.com. So that could be on your PC, on your Mac. And then you have to send the case from the iTero. So you just have to remember this workflow: iTero, PC, iTero, because once you've sent the case from the iTero, you can't add extra pictures onto it again until you send another scan. Let's say I've scanned for fixed restorative scan for a crown on a lower left one. Here's my scan, view RX. I haven't sent it yet. So we're setting it up exactly the same way as we know beforehand. We can make notes down here. That's absolutely fine. You can see the scan if you like. So this was the pre-op scan of the tooth lower left one. You see the number 1 here means it's pre-op. And we've done the antagonist, full arch scans. And this is the prep scan. And where I would normally just write a few extra notes and then send it to the technician, I'm not going to send it now. I'm going to go back to RX, go out of the scan. Yes, I'm not completing it yet, haven't sent it yet. And now I'm going to go to the PC. And I've already logged into MyiTero.com, find the same patient. And you know you have the prescription here. And now you find there's a new feature where it says attachments. So under the treatment information, which we know, it says upload photo scans, x-rays, and any other file relevant for the treatment. And it says drop files to upload, or you can browse. And it's as easy as dragging and dropping a picture just onto this area. It automatically uploads. So you have to upload on the MyiTero.com, and then you have to go back to the scanner to actually send the case. So there we go. I've given all my other information, pictures of shade, picture of stump shade, even picture of a temp, if that helps the technician. And here I've even uploaded a video. So I've uploaded a video with some information to the technician, because sometimes I want to do a dynamic recording of what is happening, and I might show the scan on the screen, rotating it and making some commentary at the same time. And then we're going back to the scanner. So I can find the case again. And you can see the scan has not been sent yet. It says scanning, so we're still active. I go to view RX. So I can't see anything here. I can't see that it's been dropped onto this area. Go to my scan. Refine. Yeah, I'm happy with that. Good. And now when I'm happy, I'm sending the file, the scan from the iTero. That means I can't add any other pictures on at that stage anymore. So just remember iTero, computer, iTero, and now I can send the case just as I normally would. And it gets sent to the technician. So the reason this is so cool is because For the technician, it's so much easier to have all the scans, the pictures, even video information all in one place. So the technician doesn't have to have emails, WhatsApps, other file sharing options. The more we keep everything in one place, the easier it is to communicate, and the technician can go back and find this information. So this is a great way for the technician and the dentist to have more of a two-way communication and keep all the files, all the information in one place.